Herpes esophagitis. What is herpes esophagitis? Herpes esophagitis is an inflammation of the esophagus caused by an infection with herpes simplex virus, or HSV. There are two types of HSV, HSV1 and HSV2. HSV1 causes oral and esophageal lesions and is often acquired during childhood. It is spread through oral contact with people with active sores, but can also be spread through genital-oral contact. HSV2 causes genital and rectal infections and is spread through sex or contact between genital surfaces. After the first infection, HSV may reactivate again at any time. Symptoms of oral herpes include painful blisters or sores around the mouth. Genital herpes is characterized by blisters or ulcers within the genital area. Within the gastrointestinal system, HSV is frequently recognized in the esophagus and often occurs among immunocompromised patients. However, HSV can also cause problems within the gastrointestinal system of healthy patients as well. This viral infection of the esophagus by HSV is called herpes esophagitis. In addition to the symptoms of oral herpes, patients with herpes esophagitis often have difficulty swallowing, pain upon swallowing, chest pain, heartburn, and may experience fever or coughs. How is it diagnosed? An upper endoscopy often reveals ulcers and redness in the mid or distal esophagus, and there may also be discharge throughout the esophagus. At this point, although doctors can suspect the presence of herpes esophagitis, it may be confused with other illnesses. Therefore, it can only be diagnosed through obtained biopsies with microscopic evaluation by a pathologist. He will look for small pieces of proteins associated with herpes esophagitis. Why might it flare up? Reasons for flare-up include a weakened immune system. This can occur due to factors such as HIV and AIDS, chemotherapy, or certain medications. These factors all render the body immunocompromised and more prone to infection. How do I manage herpes esophagitis? Antiviral medications can be prescribed to reduce the severity and frequency of symptoms. However, this will not cure the infection. Because patients with herpes esophagitis may have pain upon swallowing and difficulty swallowing, they may feel discouraged from eating and drinking sufficiently. This may cause malnutrition, weight loss, and dehydration. Oral viscous lidocaine can also be used before meals to ease pain and eating. However, this should be used with caution with children. The symptoms from herpes can be painful, and the infection can lead to social stigma and mental distress. These factors can have an important impact on quality of life and sexual relationships, as self-esteem issues arise from the signs and symptoms of the infection. If need be, talk to a friend, contact a counselor, or join a support group where you will be better able to express your thoughts and feelings. How can I prevent transmission to my partner? HSV1 is a virus that is found in herpes esophagitis, as it mainly affects the eyes, throat, mouth, and brain. As this virus can be transmitted through direct skin-to-skin contact, both orally and genitally, it is vital to remember to avoid performing oral sex when you or your partner have active herpes lesions on or near your mouth or genitals. The use of condoms may reduce the risk of transmission. However, this is not a guarantee. It is very important to let your partner know that you are living with the virus and that upon seeking treatment, to keep in mind that you and your partner can have a normal life.